And good evening, good afternoon, good morning, depending on where you are. But I know this in Nigeria, this should be good evening. And we are excited to have you all in our midst to share with us what we've been doing and what we can do to improve the standard of living in our own environment. So today we're going to go ahead and start with a presentation about the importance of uh, basic CPR, which is a little bit of what we can know that we can apply in our own house or in the streets of to help people save life. Okay, and this is not like the regular CPR because there are a lot of things that are involved with CPR training and so on. But we want to tailor this to fit environment where we are, where we come from. You know, we know there are certain things that are lacking, and then what we can do, even if we don't have the main things that we need to perform this. And let me also note that for in outside Nigeria, you have to be licensed for you to perform CPR. So, but in our own environment, we want to go ahead and tailor this to how it's going to suit what is ever is happening in the where we are in the area that we are. So, first thing is going back to the slides. So we're going to go ahead and talk about the objectives of our presentation today. We want to talk about the importance of high quality CPR and the impact it has on people surviving any cardiac arrest. Also, to apply basic life support, the concept of that in the chain of command. Also, we want to let you know how to recognize the signs and symptoms of someone that is needing CPR, okay? And then how to perform a high quality CPR, especially in an adult. We're not going to deal with kids now, pretty much, but we're going to do just for adults. And let me note that CPR is a very intense and vast thing, something to do, but it takes hours for you to get that done and a lot of training. So, but we just want to tailor this to in a little way that layman can understand it and do whatever it takes to help someone. And also we're going to talk about the technique of relief of foreign body in the airway if someone is choking and so on. So let's go ahead and start with this presentation. So basic life support is the foundation of saving lives after a cardiac arrest. Okay, and we know that number one cause of death in the world is heart disease, and more than 17 million deaths is recorded per year. Okay, so which means that this disease can even kill more than even cancer combined together. All right, so what is important here is how we recognize it, and time is key here. The earlier we recognize it and do something, the better chances of that person to survive. So despite important advances in prevention, cardiac arrest, still remains the leading cause of death in the United States, for example. About, 70% of out of hospital cardiac arrests occur at home. So if we look at that, most of them occur at home, and some of them, more than half of that is even unwitnessed. So you can imagine something happening at home and you don't even know what to do, and about 10% of those that happen at home that get to the hospital make it. So, which is a slim chance of what we do at home on the streets. The importance of that can guarantee the survival of that person as time goes on. Okay. So here we have the main components of CPR. The main thing in CPR is chest compression, which is what we want to teach everybody. I know there is pandemic, and that's why that one is, even without pandemic, this is the main thing that is, we all have to know how to do this because that is what saves lives. And then we talk about the airway, we talk about the breathing, okay? So if you look at this diagram here, we have like a little pyramid, and this tells us how CPR is performed, okay? Depending on how many people are around when this happens, depending on how experienced you are with CPR and the training you've gotten. And so if you are alone in a remote area, let me say you're in your village, in a local area, around the church or whatever, and you notice something, someone is cardiac arrest, you are alone. The main thing you can do is chest compression, which is the best that you can do at that moment, okay? So if you're a single rescuer with little training, or where we don't have the equipment, we have what we call the AED and so on, chest compression is the key. And then if you start climbing up, when you have more experience, or maybe more than one person available when this happens. So that's what we call the 30 by 2 CPR, which means 30 compressions and 2 breaths. Okay. And then when you go higher above, which is now when we talk about maybe in a hospital setting, or maybe more than one person or emergency response comes there. There are more than 3 people. One people can be doing chest compressions. The other one can be doing like bagging the person, giving them air. And then another one can be putting the AED to, shock the patient. So this is like, it goes up according to the training that you have. But for our environment, which we are trying to tailor this to, which is, for example, in Nigeria or, in Africa, where we might not have all those equipment that we need, then this is very, very important for us to do. All right. So looking at this, we already mentioned the main components of this CPR. So the first step that we want to talk about is, what do you do first when you realize someone is, getting like a cardiac arrest? So first thing is to verify that the scene is safe for you and the victim, because you don't want to be another victim by yourself. Okay. So you want to verify that it's safe for you to even perform any kind of help. All right. So once you do that, you check for responses. For example, you tap the person, hey, are you okay? Are you okay? If the person doesn't respond, what you do immediately is, if there are people around, point on someone. And there's a difference between saying, say, someone call 911, or someone call this number. No, you point at someone and delegate the responsibility. Okay, you, let me say your name is Jude. Jude, call 911 or call this and that, delegate it to someone, because when you say someone, everybody might be waiting, oh, who is the someone, and nobody helps. So you have to call someone by name, or whoever, hey, you, or point at someone, please, can you call? And that is how it happens, okay? So if the person is not responsive, you shout for that help and activate what we call emergency response. And also, we have AED, but, in the local setting, we might not be able to have this around, because let me say, for example, in the street of Nigeria, or not even in the street, even at home or wherever you are, apart from the hospitals, how many places do you even see AED? How many places do we see, even the ambulance? If you call ambulance now, how many of the places do even hospitals even have ambulance? People just associate ambulance with maybe someone dies and, taking the corpse to maybe a mortuary or something, or for burial. But, this is something in developed countries, they have it all around everywhere. Just a little call and they're there. But if we don't have those, it doesn't mean that we can't still do something to help our people. So that's why I said that chest compression is number one. So once you notice, the person is not responding or whatever, you call, hey, you call 911 or make a call this. So the first thing you want to do is to assess if the person is breathing or if they have pulse, okay? So to minimize the delay of anything that you want to do, it has to be fast. Everything has to be done within 10 seconds. Because as I said earlier, the time is the key for the person to survive, all right? So the first thing you want to do is, hey, are you okay? No, you can use your fingers, or you just come closer, feel if they are breathing, watch the way they are, breathing or not, or you can check the pulse as soon as possible, okay? And then if you see that they are gasping for air, it means that they are not having normal breathing, which means it's a sign of cardiac arrest. And so what do you do? Where do you check the pulse? So this is a little picture that shows you what we call the carotid pulse. This is where you check that. So you check, feel if they're breathing or not, if they are gasping for air. That will help you check the pulse. And this is how we now determine what we're gonna do next, okay? So based on this, if you notice that the person is breathing normally and has a pulse, so you want to monitor the person, okay? But if not breathing, but they have pulse, okay, you want to provide rescue breathing as soon as possible. I know this is hard to do now because of the pandemic, COVID, so a lot of things is not going to be, restricted, because, you can't be doing all those breathing and so on. Even here in the United States, they have the bag and they connect something to prevent viral or bacterial infection from going through the bag that they use for the person. But, back home, we might not have all those, but chest compression is still the key. Within 10 seconds, you have to evaluate the person, if the person is okay or not. And then you start CPR as soon as possible, okay? You start the CPR. So if you notice even the person is breathing normally or not breathing normally or just gasping to get some air, you have to go ahead and start high quality CPR, because that is what that is going to make the person survive, and time is running already. All right. So when you notice that the victim is, even if the chest or whatever they are wearing is too tight, if possible, you can open it, just open it, tear it open if possible. That's fine. The main thing is to save life. And then talking about the AED, I know in an area, we don't really have AED on the street, I said earlier. For example, let me give you an example of what happened somewhere. I don't know if some of you saw the video going on online about a guy that was, dancing and, performing, and people were just clapping, and this guy collapsed. He fell on the floor, and people thought he was still the part of the stunt, that he was still like, it's part of the joke or part of the dance. And this guy was going into cardiac arrest. Nobody did anything, and people, what happened in the street even now? If someone falls down here, what do people do? You see people, first of all, bring out their cameras, they start covering, and people crowd, surround the area. We see that a lot in Nigeria. Instead of giving the person space to breathe, everybody's want to surround the person instead of doing the regular thing that they're supposed to do, which is that chest compression. So that's why we saw those. We're like, this is not good. We have to teach things. Even if, like, your family, you could be the person to save your mom, your dad, your uncle, your aunt. If you know that just little chest compression, if you realize this is cardiac arrest, that could go a long way to, keep the person alive. So that's why we want to make sure we push this more and more. So what is involved in this CPR? As I mentioned earlier, if you're the only person, you can go ahead and do 30 compressions and 2 breaths. But because of COVID, even if you don't do the breath, go ahead and continue with the chest compression till help comes, okay? And then when you do chest compression, that's what we call, it has to be at the rate of 100 to 120 per minute. So which means approximately 2 deep compression within a second. It has to be fast. It has to be fast. And then as you're compressing the chest, it has to be deep, approximately 5 centimeters, for you to make sure you're giving effective chest compression. Also, you have to give enough time for the chest to recoil, which means you go down against it and give enough time, you go down and then allow for the chest to come back up completely before you go down again. All these like 2 compressions within seconds. That's how we do this. And once you start doing this, you have to minimize the number of interruptions that you get. So that chest compression is what we have to keep doing till we get help, or maybe you can get the person to the hospital. So where do we do this chest compression? As we look at this, let me say someone just falls down here, and then you come in and see that this person is not, is going into cardiac arrest. So what you have to do, even if the person is facing down or even sitting on a chair, first thing you have to do is turn the person, put them on a hard floor, no matter, not on the couch or not on the bed, no, because you have to make sure that chest compression is very effective. Put them on a hard floor, lay them down flat on the floor, facing up. That's the first thing that we do, okay? And then when you suspect there is a neck injury, you don't want to move the person too much, but let them face upwards, okay? And then look at this. This is where we put our hands. So how you do this, you position your hand one, and then you put your interlock it inside. This is where you use for the chest compression. So you look at the breastbone in the picture here, you position your hand there, and make sure your hand is straight. If you can see this picture, this guy's hand is straight, just so you can use, your strength to do it. So you go in, down about 5 centimeters, which is about 2 inches. All right, so about 2 pushing in 1 second. That's how we do that. All right, that's what we're going to save this person's life. We have what we call the AED, but as I said earlier, if you're on the street, or even if in your own house in Nigeria, or wherever you were, maybe in Africa, you're not going to have this. How many of us have even seen this? Even some hospitals might have it, they might not have it. So we're talking about what happens on the street or at home. You're not going to have this. But if you have this, or you happen to have this, then once you put this, you have to follow the instruction. It guides you on what to do. It tells you when to push, when to shock, because when you shock, it helps the person to bring back the rhythm of the heart. But, if you're on the street, you're not going to have this. So that's why we always tell you the first thing is realize what is going on and start that chest compression, because that's what's going to save that person's life. All right. So you go back, if you do the AED, when you have it, follow it, the instructions to and fro. And then when you're done, it's going to tell you to continue CPR. You should continue to do normal, high quality CPR, go into that depth of 5 centimeter, 30 by 2 if you're alone. All right. So that's what we'll continue to do. Another thing we need to realize is if you are doing this, or maybe they call you or something happens, and how do you recognize if someone is choking or maybe having any obstruction? You know, there is something that we call Heimlich Maneuver. Okay, this is another thing we want to let people know. Like if you notice if someone having like a little obstruction, midway obstruction of the chest, all right? So what you're gonna do first of all is look at the person, observe the person. Like you might have difficulty coughing, or they might be wheezing, like the way they were breathing. You know, there's something's going on. This person is choking, all right? So what you can do is just monitor them as soon as possible and see if you can call for help immediately, because that's gonna say. But if you see it's something severe, you see someone holding his neck, like you know that the choking sign, the person is choking, they're unable to speak, or they want to say something, it's like a high pitch, like they can't even talk. You know that's, or they're turning color, changing color to blue, and then you know that this person is already this. You need to start something as soon as possible. Okay, so what do? All right, you can ask them, are you choking? You can see they won't be able to talk. All right, and what you have to do is get them, find a way to relieve that. Okay, we don't do like put hand in the mouth and trying to find whatever is choking. No, you don't do blind swiping of the mouth. All right, so what you're gonna do is position your hand. Let me show you this picture. You go and stand behind the person and you make a fist with one hand, and then you interlock it with the other one, and then where your thumb is going to be near the breastbone, just below it, okay? And then you push it up like a thrust, okay? And you thrust as much as possible, like push, in and out as many as possible to help the person remove whatever is blocking the airway, and that's how to get that thing off. So this is what we call the Heimlich maneuver. I know it might be difficult to see that just, online like this, but that helps a lot. So if you do that a couple of times and the person is not getting that thing up, or maybe you'd be surprised, whatever is choking them might just fall out from their mouth while you're doing that, and you must have saved life. But then, even if you do that, still advise the person to go to the hospital for checkup, because it could be from your compression, they might be injured due to all those thrusts that you're doing in the abdomen or near the chest. But the main thing there was to save life. Okay, so you still encourage them to go to the hospital. And then if you do that and they finally become unresponsive, all right, what you have to do is lay them down on the flat surface. As we say, it has to be like a flat surface. Lay them down and then start the CPR that we discussed earlier. All right, chest compression. If you have what we call elbow bag, you can do that. But because of COVID, nobody's doing all those mouth-to-mouth respiration anymore. All right, but the chest compression is going to help to get the person back to where they're supposed to be. All right, so if they are pregnant, of course, pregnant women, they have their belly already up. You can do the chest compression on their belly. So you can go a little bit upwards and do the thrust to help them relieve whatever is choking them. All right, so we encourage them, as I said earlier, even after they get themselves back to normal, or you feel they are back to where they're supposed to be, encourage them to seek medical treatment or go see a doctor to review them and see how they are doing, okay? So those are the things that we want to push for. Also, in summary, there's something we call, for you to remember what to do if someone is having cardiac arrest. We call it, you can use what we say like doctor's ABCD, all right? So doctor's ABCD means from step 1, recognize as a danger, all right? If you recognize as a danger, then what the R is gonna be your response. What do you do, all right? And then if you do know what you're supposed to do, what else is, the S is shout for help. And then you check the airway, the breathing, the circulation, and then the defibrillation, which we don't really have in a normal setting outside, maybe third world countries, So in summary, every one of us can be a lifesaver, okay? If someone is having cardiac arrest, if you see the person is not breathing, no pulse, and so on, The number one thing is time. Within 10 seconds, start CPR. Start that chest compression because you might not have any other thing. That will be something that will help the person to stay alive. Go to put your head, position it where you're supposed to, where we showed you, put it there and start making it that, push about 5 centimeters down, in and out, okay? And then in the remote areas on the street, as I said, that's the only thing you can do because you don't have any other help, nothing that will help you there, okay? And then if you're more than 2 people, start with that 30 by 2. And if more people come, then you can now start, taking turns to make sure the person is getting enough chest compression that they need. And it has to be at least 2 compressions in 1 second. That will give us approximately 100 and 120 per minute, okay? So that's what we want to preach on. And then if you go here, remember we say Dr. ABC, the D is the danger, R is the response, S is the shout for help, A is airway, breathing, circulation, and defibrillation, okay? So in that, I'm gonna just go ahead and play a little video for you guys to see like a summary of this.
Hello. In this health sketch, we want to talk to you about CPR, which stands for Cardiopulmonary Resuscitation. We use CPR when someone has collapsed and is not breathing because it can keep people alive until emergency services arrive. Learning these simple life-saving skills is as easy as ABC. All you have to remember is the doctor's ABC. D is for danger. First, look around carefully to make sure the area is safe for yourself and others before approaching. R is for response. Shake them gently by the shoulders and ask them loudly, "Are you all right?" If there is no response, you need to. S. Shout for help, as any assistance will be helpful. A is for airway. Gently tilt the head back like this to open up the airway. B is for breathing. Look, listen, and feel for signs of normal breathing. Look for normal chest movements. Listen for normal breathing sounds. And try to feel their breath against your face. Do this for no more than 10 seconds. If there is no sign of breathing, or if they are breathing in an unusual, noisy way, we need to start CPR. First, make sure that an ambulance is on its way. If you have someone with you, ask them to make the call. Putting the phone on speaker mode is useful as the ambulance service can talk you through the steps. C is for circulation. Circulation means the flow of blood around the body, and when the heart stops pumping, we need to take over this role by pushing down hard and fast on the chest. Start by placing the heel of one hand at the center of the person's chest and interlock your fingers like this. With arms straightened, press down hard and fast, letting the chest come back up fully each time. Fast means around 2 times every second. And hard means that the chest needs to go down by about 5 centimeters. This might sound a lot, but you do need to push hard for it to be effective. If you have been trained, you can give 2 rescue breaths after every 30 compressions, as this helps provide some oxygen. However, if you have not been trained or are not comfortable, just keep going with hands-only continuous chest compressions. If someone else is with you, swap over if you begin to feel tired, and don't stop until either a health professional takes over or the person is definitely breathing normally. Sometimes we can add another step. D. D is for defibrillation, which is about delivering a shock to restart the heartbeat. Some public areas and workplaces have an easy-to-use defibrillator on site, called an automatic external defibrillator, or AED. Automatic means that it is the machine that decides what to do, so you can't go wrong, and it even talks you through the steps. If there is no AED available, keep going with CPR until the ambulance arrives. That's it. So to recap, remember doctor's ABC, and if you have it, D. That's D for danger, R for response, S, shout for help, A for airway, B for breathing, C for circulation, and D for defibrillation. In this health sketch, we've shown you the simple steps you can take to help someone who has collapsed, is not breathing or not breathing normally. Why not take a training course to practice these steps? Share this video with friends and family to make sure we all know what to do. Health sketch. Health for all to see. Hello. In this
So based on the video that we watched, I know we're talking about the remote areas where we are. It could be in your village, it could be in your house. You know, you might not have some of those things. You might not have the AED, you might not have the ambulance. You know, even if you have the ambulance, most of the time the road is not good. So time is already running. All right. So we can't wait for all those. But what we can do initial time, as we said, is chest compression. The earlier we start this chest compression, the better chances of that person surviving. So if each one of us, you know, if we go home, go to our families, our friends, or be on the street, our working place, and someone just collapses, let us not just pick up the phone and start covering and trying to record what is going on. Let us not all just surround the person. The person needs air, even if the person, but we notice people just surround, you know, the person that is laying down. Know what to do. Check very fast within 10 seconds if they are breathing or not, if they have pulse or not. If not, start the chest compression. That is the key to saving lives. It could be anybody, it could be at home. You wouldn't know when it will happen, but if all can apply this to our family members, our friends, God forbid anything happens to them, that will save life. Okay, so we want to give credit to American Heart Association, the Health Sketch, the Chest, Heart and Strokes of Scotland, and then the National Registry of Emergency Medical Technicians for helping us with this presentation and the credit. And also, we want to say that even for CPR in outside Nigeria, you have to be licensed for you to do anything. But we are tailoring this to our Nigerian community, our own local area, where we can help save life because we don't have most of those around. Okay. So thank you very much. If you have any question, you can reach me at this address, email address, and